So good afternoon and welcome to our December Town Hall. This month, we will be reviewing North LA eligibility and our intake and assessment process. And I have 3 additional staff with me today. So I'd first like to introduce Dr. Weller. He is our Chief of Program Services. I'd also like to introduce Dr. Carlo D'Antonio, our Director of Clinical Services, and Dr. Sandy Fisher, who is our intake supervisor and our consultant psychologist on staff. So I'm going to go ahead and turn it over to Dr. D'Antonio.
Oh, well, good afternoon, everybody. Thank you, Ruth, for the introduction. And as Ruth mentioned, I'm Dr. Carlo D'Antonio. I'm our Director of Clinical Services, and I am a pediatrician and our clinical director, and I've had previous experience with UCLA as a clinical instructor of pediatrics, as well as an assistant professor of pediatrics at UCLA and Olive View Medical Center. And I wanted to start out by talking about our intake and assessment process. And I wanted to, in this presentation this afternoon, try to give the community a little better understanding of a regional center eligibility, what conditions would qualify somebody to be eligible for regional center, and a little bit about the 5 different categories of developmental disability that we serve, and also walk everyone through a little bit of our intake and assessment process so that people can better understand the process that North LA uses to help determine eligibility. So the first thing I wanted to talk about was about what are the criteria to be eligible for regional center. And it's important to understand that the regional centers in California administer 2 large programs for children with developmental disabilities and also children that are at risk for having disabilities or delays. So the first program is our Early Start program. And that is a federal program that is in all 50 states of the United States. And in California, the Early Start program is managed through the regional center system for the most part. And in many of the states, it's actually managed through the educational systems in other states. But in California, it's managed through the regional centers, as well as with co-administered with school districts for certain components of the program. And then the second program that regional centers manage is the Landerman Program. And that's for individuals with a substantially disabling developmental disability. And I think it's important to emphasize that these are actually 2 completely separate programs. The Landerman Program is unique to the state of California, and the Early Start program is a federal program that's available throughout the country. The programs have different eligibility criteria. The Early Start program is designed as an at-risk program for children up to age 3 that may be at risk for having a developmental delay or a diagnosis that is highly associated with developmental delay, or are exhibiting developmental delay in at least one developmental domain. It's an at-risk program so that early intervention services are provided to help change that child's developmental trajectory. And so those children in Early Start don't necessarily have a developmental disability. They are at risk or have delays. The Landerman Program is a program for individuals that have a diagnosed developmental disability and are substantially disabled by it. And that is a program that is available throughout the individual's entire life once that developmental disability is diagnosed. Just newly in July of 2020, the legislature of California added another component to our Landerman program, which allows us to provide provisional eligibility for 3- and 4-year-olds where the diagnosis is not quite certain, and it provides a little more time to provide services and supports to those children and to be reassessed when they're a little bit older to help confirm if a developmental disability is present. So I wanted to emphasize those 2 different programs that are housed in under one roof. Now, the focus of today's presentation is going to be on the Landerman program. I'm not really going to talk much about Early Start today because there's just so much material and only so much can be covered in this afternoon, but we're going to really focus on Landerman eligibility today. So going on, so as I mentioned, to be eligible for the Landerman Program, an individual must have a developmental disability. And it's important to emphasize that the concept of a developmental disability is really a legal term. It's a term that's defined by the laws and regulation of the state of California in California. Different states in the United States have different definitions of developmental disability. And actually the federal government has a different definition of developmental disability than California. Now there's a lot of similarities between the definitions, a lot of overlap, but there's slight differences between those different definitions. So it is possible that somebody could be eligible for developmental disability services in one state and possibly not be eligible in another state because there are slight variations in those different definitions state to state. So I just wanted to emphasize that the definition is specific to California, and also the definition is a legislative definition, and over time, the definition has actually changed over time. So there may be individuals that in the past may not have been eligible for regional center, but could be eligible for regional center services today because the definition has changed somewhat in that the criteria has expanded in certain ways, or the diagnoses that can qualify for developmental disability have changed over time. So that's, I think, important to recognize that it is something that is defined by the legislator of the state of California, and there has been changes over the 50+ years that developmental disability services have been in place in the state of California through the regional centers. Now, there are 5 conditions that the state of California says are developmental disabilities in California: intellectual disability, cerebral palsy, epilepsy, autism spectrum disorders, and disabling conditions found closely related to intellectual disability. I'm going to try to talk a little bit this afternoon about each of these conditions so that you can get a better understanding of what those conditions are and the types of individuals that have those types of diagnoses. Okay. Now, the definition in California, it's not just having that condition. You also have to be what's called substantially disabled by that condition. So that's an important distinction. You have to have the condition diagnosed, and then you also have to be disabled by it. So it is possible that some individuals may have a diagnosis of epilepsy, but they're not impaired by it in any way, and that person would not then be considered to have a developmental disability, for example. That's just an example. So the law specifies a little bit about what this concept of developmental disability is. The first point that's important to understand is that a developmental disability must originate prior to the age of 18. So it's important to understand that developmental disabilities are considered disabilities that are present during childhood. These are conditions that most people with developmental disabilities are born with them, or they acquire them at some point during their childhood or very early in their life. So it's important to understand that in the lifespan of an individual, there are things that can happen to somebody later in their lifespan. A young adult who's in their 20s could be in a terrible car accident and have severe injuries or brain injury from a car accident, and they could be very impaired, but they would not be considered developmentally disabled if that injury or accident occurred in their adulthood, if at the age of 19 or 20 or 21, for example. Or sometimes there's adults who have other types of degenerating conditions in their in adulthood. For example, an adult could have dementia through Alzheimer's disease or other conditions, or maybe they could have a stroke when they're older, as an older adult, that's very impairing or disabling, but that's not considered a developmental disability because it's occurring during adulthood. Okay, so we're looking at conditions that are occurring during childhood. So that's the first important thing to understand. And the second thing is that the condition is supposed to be a permanent condition. There are some medical conditions that can be very impairing, but the child recovers and can return to their prior level of function. An example of that could be some forms of, for example, viral meningitis. Sometimes a child could get, which is an infection of the brain area or the fluid around the brain. And a child could be very impaired from that, but they can, with medical treatment, recover and return to their prior state of health. So even though for a few months that child may have been in the hospital and very impaired from that condition, that would not be considered a developmental disability if they're able to return to their prior level of functioning with no other impact, just as an example. And also, as I mentioned before, the condition must be substantially disabling for the individual. So for example, I gave that example of epilepsy. There's some people who could have seizures, but they take medications, and the medications, they haven't had a seizure in 4 or 5 years, and they're doing well, and no other impact from the condition other than maybe the fact that they have to take a medication, or maybe they don't even need to take medication anymore. So that's an example of an individual who may have that diagnosis of epilepsy, but they no longer have any impact from it. So that's not considered a developmental disability. Some forms of cerebral palsy, for example, can be very, very mild and does not impact an individual in their day-to-day functioning in any way, so that it would not be considered a developmental disability, even though they have that diagnosis. So that's another thing to understand, is that the condition has to be substantially disabling. Another component of that definition of developmental disability is the fact that the condition also has to be there's certain exclusions to the definition. One is that that conditions that are solely physical in nature are not included in the definition of developmental disability. So there's some individuals that can be very impaired from an accident, like a leg amputation or a medical condition that is very impactful to that person. But if it's a solely physical condition, it's not considered it's not a developmental disability. Now, we do serve individuals who do have physical impairments in addition to a developmental disability. And I can give an example of that with some forms of childhood muscular dystrophy. Muscular dystrophy is a medical condition where there is weakness or degeneration of the child's muscles. And those children can be very, very extremely physically impaired. But there are some forms of muscular dystrophy that are also associated with intellectual disability, so that we can serve that individual because they're intellectually disabled in addition to having a physical disability. Now, another exclusion are mental health conditions, the psychiatric disorders. So the law specifically excludes primary psychiatric conditions from the definition of developmental disability. So people can be very impaired from psychiatric conditions, but those conditions in and of themselves are not considered developmental disabilities. However, there are individuals who have an established developmental disability, perhaps prior to the onset of their psychiatric condition, and we can serve those individuals because they have an established developmental disability in addition to their psychiatric condition. So that's an example that we can dually serve an individual, but if somebody has only a psychiatric condition, that's specifically excluded. And it's similarly with learning disabilities. Learning disabilities are also excluded, and they're not considered developmental disabilities. So moving on, we mentioned that an individual has to be substantially disabled, and there's 7 areas that the law states to consider when looking if somebody is substantially disabled. And the definition of substantial disability is that an individual has deficits in 3 or more of these areas. So for example, a child with intellectual disability could have deficits in language, their learning, and maybe their ability to take care of themselves. So those would be the 3 areas that would qualify that person as being substantially disabled and intellectually disabled, for example. Now, when we're looking at young children, we don't really look at the capacity for independent living or economic self-sufficiency because no young child is expected to meet those criteria. So those are just examples of how an individual needs to have limitations in 3 or more of these areas as outlined in California law and regulation. Now, I mentioned that just this year, in July of 2021, the state of California's recommended creating another program for Landerman eligibility called Provisional Eligibility. And this is for children that are 3 and 4 years of age who have been diagnosed with a disability, but is not necessarily a developmental disability, and they're exhibiting functional limitations in 2 or more areas. So when we assess our children, and I'll talk about our assessment process in a little bit, we assess the children to determine if they have developmental disability. But if we are dealing with a 3 or 4-year-old and we do not diagnose a developmental disability at that time, but we notice that they have another condition, like a language disorder or maybe global delays, for example, and they have adaptive impairments in 2 or more areas, we will recommend them for the Provisional Eligibility Program, where those children can receive services through the regional center for ages 3 and 4, and then prior to age 5, they're reassessed to determine if a developmental disability is present. So it's wonderful that the state of California created this additional category, and this allows us to closely monitor and serve those 3 and 4-year-olds that are too old to be in the Early Start program, but there still are concerns about their development, and we can monitor those children and help connect them with resources and reassess them when they're a little bit older, and we can probably get a better diagnostic assessment of them when they're a little bit older. So this is a new program this year, and it's a great benefit for our community to have this available for these young 3 and 4-year-old children. Now, I'm going to spend a little bit of time talking about the different areas of developmental disability, to give the community a little bit of understanding what it means to have a diagnosis of intellectual disability. Now, the diagnoses such as intellectual disability, they're all defined in a book, really, called the DSM, which is the Diagnostic and Statistical Manual, which is a book that psychologists and psychiatrists use, which defines many of the conditions such as intellectual disability, as well as other mental health conditions and other conditions. So they're formally defined in this book. And intellectual disability is a condition that was redefined in 2013, so about 8 years ago. Before that, this condition used to be called mental retardation. And in 2013, the name was changed to intellectual disability. And also some of the technical aspects of the diagnosis were also modified during that time. And basically, the definition of intellectual disability is that an individual has deficits in their intellectual or cognitive abilities, as well as deficits in their adaptive abilities or abilities to do things in their day-to-day life, their activities of daily living. So somebody needs help cognitively, as well as needs assistance in their day-to-day activities of living, such as maybe, doing things independently, getting dressed, learning how to make purchases in the community, those types of things. And also, it has to occur during the developmental period. If somebody has cognitive or adaptive deficits later in life, as an adult, like a 60 or 70-year-old, that would be considered possibly dementia, right? But when it occurs in the early developmental period during childhood, it's considered intellectual disability. Okay, so how do we figure out if somebody has intellectual disability? Well, a licensed clinical psychologist administers a series of tests or diagnostic instruments, and I've listed the names on the slide of some of the common ones that are used. And they use different tests depending on what age what age the child is, and that helps understand the individual's cognitive abilities as well as their adaptive abilities. These tests are commonly known as IQ tests. You've probably heard that term, right? So these are the types of tests that a licensed clinical psychologist would administer, and based on the results of those tests and the scoring of those tests can determine if that individual has an intellectual disability or not. So that's a little bit about intellectual disability. Now, autism is another condition that is also defined in this Diagnostic and Statistical Manual. And the definition was also completely overhauled in 2013. You may be familiar with terms like Asperger's disorder or pervasive developmental disorder, commonly called PDD. Those terms were actually discontinued the use of after 2013, and in the new definition of autism spectrum disorder, kind of combined all of those conditions to some extent into one diagnosis called autism spectrum disorder. And in this redefinition of autism, it actually greatly expanded regional center eligibility, because previously regional centers could only serve people with autism, and people with Asperger's did not qualify for regional center services. But with the new definition of autism spectrum disorder, that new definition encompassed many of those other diagnoses to some degree of Asperger's and PDD. And so it probably made more people could meet criteria for regional center services with the new definition that came out in 2013. Now, how is autism diagnosed? Well, that is again diagnosed through psychological assessment by a licensed clinical psychologist. And the main characteristics of the diagnosis involve deficits in social communication and social interaction in combination with restrictive and repetitive patterns of behavior. Okay. And how that's diagnosed is through an assessment of the child and the administering of certain diagnostic tools with both components of a standardized interview with a family member or caretaker, as well as a standardized observation or assessment of the child in which, for example, social scenarios are presented to the child in a standardized fashion, and the psychologist grades or scores the child's response in these types of situations. Our assessments of autism also include cognitive and adaptive testing, but we also, psychologists also utilize these types of assessment tools to make that diagnosis of autistic spectrum disorder. Now, moving on, and there's lots of material here, and it's a fast-paced talk, but moving on, I want to talk a little bit about cerebral palsy. Now, this is a little shift because intellectual disability and autism are more psychological diagnoses, and cerebral palsy is more of a medical diagnosis. Now, cerebral palsy is a condition where there's some type of injury that occurs to the developing brain of an infant, or prenatally during fetal development, or postnatally around birth, or in very early childhood in the first months or year of life. Some type of injury occurs to the developing brain that affects the ability of the brain to control movement and posture of the body. Okay, so when we think of cerebral palsy, and many people are familiar maybe with images in their mind of what a person with cerebral palsy may be like in terms of somebody in a wheelchair, or having difficulties with moving their arms, or difficulties with their motor function. It's important to understand that cerebral palsy is a condition of the brain, and that there's some type of injury or lesion to the brain of that individual that controls that individual's ability to move their muscles and control their movements. And where that area of injury to the brain may occur, changes the way that person might look in terms of what parts of their body are affected. So you can have somebody with cerebral palsy that is impacted due to the area of their brain that's impacted in all four extremities, their arms and the legs, and that's called quadriplegia. Sometimes there's just the motor parts of the brain that control physical function in the left side of the brain are involved. So then the right side of the body would be physically affected. That's called a hemiplegia. And there's different types depending on whether that impact to the brain creates spasticity or tight muscles, or sometimes they create other conditions like athetosis, which are writhing or discoordinated muscle movements. I think one thing that's important to understand when we talk about cerebral palsy is many individuals with cerebral palsy, although they might be very physically affected, they are not affected cognitively. So there's many individuals with cerebral palsy that have no impairment in their cognition, but they can be very physically affected. And we can make those people eligible for regional center because cerebral palsy is one of the named developmental disabilities. But there are other people with cerebral palsy who also have significant intellectual disability as well. So there's a variety, and everybody is different. Every individual is unique. And when we talk about cerebral palsy, as I mentioned earlier, it has to be substantially disabling for that individual, which means the cerebral palsy has to be disabling in 3 or more areas of life activity. And many individuals who are eligible with cerebral palsy have need some type of adaptive equipment for their functional mobility, such as needing a wheelchair or a walker, et cetera. There are sometimes milder forms of cerebral palsy that may not be substantially handicapping. Those are just some examples. Now, I wanted to also move on and talk a little bit about epilepsy. Epilepsy is quite a common condition, and we often see it very commonly as a co-occurring condition with other developmental disabilities like intellectual disability, cerebral palsy, and autism. Now, epilepsy can occur at any time. It occurs at various times in people's lives. There are adults who've had no epilepsy their whole life, but at age 60, they might have a stroke, and after having a stroke, they might develop epilepsy. Okay, those individuals that had that adult onset epilepsy would not be considered developmentally disabled. So when we're looking at epilepsy as a developmental disability, we're looking at epilepsy that the onset of the epilepsy was prior to age of 18. So it's a childhood epilepsy, okay? And epilepsy is a condition of recurrent unprovoked seizures. So there's individuals who can have seizures, but seizures in and of themselves do not mean somebody has epilepsy. So for example, young toddlers with a young toddler who has a high fever can sometimes have seizures associated with high fever called febrile seizures. But febrile seizures don't necessarily mean that that person has epilepsy. So I just wanted to clarify that not all seizures mean epilepsy. Now, again, there are many different types of seizures, and they're characterized medically by whether they occur with impaired awareness or loss of consciousness or without loss of consciousness, whether they involve motor function or not motor function. So there's different ways of classifying, and there's many different epilepsy types. And there's also different causes of the seizures. Sometimes there's a genetic predisposition, sometimes they're related to structural abnormalities of the brain. And there's some children who have what are called epileptic syndromes, where there are known conditions that are associated with very severe epilepsy. Now, epilepsy is generally diagnosed by neurologists, and there's a series of testing that most neurologists use. And many people with epilepsy are able to receive a very effective treatment for epilepsy using anti-epileptic medications. And often those anti-epileptic medications are matched to the specific seizure type. And sometimes there's even surgical techniques that can be used to sometimes remove an area of the brain that is causing the seizures to generate. And by removing that area of the brain, it can be very curative or greatly reduce the number of seizures a person has. So that's a little bit about epilepsy, about how it's diagnosed and treated. Now, again, when we're looking at regional center eligibility, we're looking at people who are substantially disabled by their epilepsy, people who have impairments of 3 or more areas of life activity due to their epilepsy. So there may be children who have seizures or had a diagnosis of epilepsy, but they're well controlled. They're on medication and they haven't had a seizure in years, or they haven't had a seizure in years and they've taken them off medication. So those individuals probably wouldn't be considered eligible as having substantially handicapping epilepsy if they're no longer being treated for it or no longer have seizures. So when we're looking at children who have substantially disabling epilepsy, it's individuals who have very difficult to control epilepsy often, have many are on multiple medications or have other and the epilepsy in itself has a major impact in multiple areas of that person's life functioning. Now, coming to the last of the 5 conditions of regional center eligibility, it's conditions similar to intellectual disability. And this is often a condition that it can be quite confusing to the community in what exactly this is. And understandably so, because this condition is a condition that is not a specific medical or psychological term, but it's more of a term created by the legislature of the state of California. It's kind of a legislative condition. And so it's something that is interpreted interpreted by the Department of Developmental Services to represent certain individuals. And so when we think about a condition similar to intellectual disability, intellectual disability is characterized by cognition and how that person's cognitive function is. So when we think about what is a condition similar to intellectual disability, we're thinking about people whose cognitive functioning is at a similar level to the cognitive functioning of individuals with intellectual disability. So there are some individuals who have very low cognitive abilities, but their cognitive abilities are not quite low enough to be formally diagnosed with intellectual disability. And one of the terminology that's used is borderline intellectual functioning. And so many individuals who have these types of borderline cognitive skills, as well with significantly impaired adaptive deficits, and are substantially disabled in 3 or more life areas, may be considered as eligible under the condition similar to intellectual disability. I think it's important for the community to understand that it's not a condition for any person who's having some type of issue that's not one of those other 4 things. This is more of a condition where it's somebody whose cognitive and adaptive profile is very similar to the cognitive and adaptive profile of an individual who's intellectually disabled, but they don't quite meet the formal criteria for that diagnosis of intellectual disability. So that's a brief summary of that condition and those 5 conditions. So we've talked a little bit, and there's lots of material here, but we've talked a little bit about the criteria in California for the definition of developmental disability and some of the exclusions of that definition. And we've also gone through the 5 named conditions in the state of California that are considered developmental disabilities in the state of California: intellectual disability, autism spectrum disorder, cerebral palsy, epilepsy, and conditions similar to intellectual disability. And I'm going to move on now to talk a little bit about how North LA County Regional Center figures all this out, right? How do we determine eligibility under the concept of developmental disability? Again, I'm not speaking about our early start program. It's a little bit different process for our early start eligibility determinations. But in the interest of time, we're just going to focus on our Landerman eligibility, okay? So it all starts with our intake and assessment process. And it generally starts with a request of service coming from an individual in the community. And we have a application that's available on our website or that can be used through a mobile, through a mobile device. And somebody can indicate what their concerns are about the individual. They provide their demographic information, who they are, where they live, so we can make sure that they reside in our catchment area. And we can make sure they're not somebody who has history with the regional center in the past, somebody who may have been in an early start program before. So we figure out, make sure this person is in our catchment area. And we also make sure that the person has consented to be evaluated. Sometimes we get referrals from well-intentioned individuals in the community. It could be a family member, it could be an outside agency, but we want to make sure that the legal guardian or the legally responsible party or the individual of this adult applicant has actually agreed to be evaluated through regional center. And we also try to collect as much medical or prior psychological information or school records as possible, because these can be very helpful with making that diagnosis. We conduct what's called a social assessment, where we interview that family or that individual, depending on the age, and find out more about that individual's history, their functioning levels, what types of medical conditions they have. Are they taking certain medications? Where did they go to school? How are they doing in school? Do they have an IEP in school? Getting this information about that family, about that individual as part of our social assessment. And then we review the individual's medical information for those medical diagnoses about cerebral palsy or epilepsy, or we conduct psychological testing using some of those diagnostic tools that I already talked about in our discussion, and to help make that diagnosis and to see if we can make that diagnosis of intellectual disability or autism. And during this process, we also provide families information about community resources, about services available through an IEP or for an older individual or the Department of Rehab or mental health services if those are appropriate. So sometimes people are referred to us because they're having issues, but those issues are not necessarily developmental disabilities. So we want to make sure the first step is to rule out, make sure that if somebody has a developmental disability, but we also if we're aware that the issues affecting that individual may be more of a mental health component, to provide that individual information with mental health resources in the community, for example. So we are a really busy program. We get a lot of requests for service each month. So we get about 650 requests for service every month. It varies month to month, but that's an average. And that's for both our Early Start and our Landerman programs. So there's a huge demand in our community for services, and we work in our teams and our providers work to assess individuals and determine the diagnosis of developmental disability. And we do a lot of diagnoses a month. We're a very high volume regional center, probably one of the highest in the state of California. And the amount of assessments we do is quite high. So we do a lot of assessments. And during COVID, we had to make some adjustments. When we were in lockdown and our offices were closed to the public, we still continued to assess individuals for Landerman eligibility. We did this by pioneering some ways that we could assess people virtually through telehealth platforms, so that we could do telehealth type interviews to try as best as possible to determine the presence of a developmental disability and modify the testing that we do in order to see if we can present that testing through a virtual format. And it was successful, and we were able to provide eligibility determinations all throughout the COVID pandemic until July of this year, where we reopened to the public so we could do in-person testing again. During the time that we could not do face-to-face evaluations, the California did allow us to do temporary eligibility or presumptive eligibility for some cases where we weren't quite 100% sure, but we wanted to give that individual the benefit of the doubt, and we offered presumptive eligibility, and then we were able to reassess once we were then able to do more detailed in-person assessments. And in many cases, those reassessments would just confirm the prior suspicion of developmental disability before. So, and then when we also reopened to the public, we also invited some of those families back for additional assessment so that we could make sure that we did the full assessment to determine eligibility for those cases impacted during the COVID lockdown when offices were closed to the public. And our timelines, the statutory timeline is 120 days for Landerman eligibility determination. We work very hard to make sure that we can determine eligibility within those statutory timelines. There is a provision in the timeline when there's a risk to health and safety that we can expedite or have a shorter timeline. Some examples where that shorter timeline might apply is with our, sometimes we get referrals from forensically involved individuals who are in custody, and the eligibility determination is going to help determine the type of custody placement that that person has. And so the courts are very anxious for that determination because it's going to impact the what type of the legal process for that individual. There's been other situations where there has been health and safety type issues where maybe there is a dependent adult in the community who is cared for by and they have not previously come to the attention of the regional center system, and their care provider has passed away or become incapacitated, and then that person needs supports immediately. And so that's another instance where we've seen those health and safety risks in the community. Who determines eligibility? And the community should know that the eligibility determination is a multidisciplinary process. And at North Los Angeles County Regional Center, we have a team of licensed clinical psychologists, as well as board certified pediatricians, as well as a board certified developmental behavioral pediatrician who look at every case and look at all of the information in a very holistic fashion in terms of the assessments and outside records when they're available to make those eligibility determinations. A lot of families provide us with assessments that may have been done outside through other assessment centers. Sometimes there's families that have been assessed in other states. They maybe have received developmental disability services in another state and they have the assessments from that other state, or they've been assessed and diagnosed with a developmental disability through another provider in our community. There's many excellent developmental disability programs in our community through places like Children's Hospital, UCLA, Kaiser, et cetera. And oftentimes families are assessed at those centers, and then those centers refer those children to us, and the families have those copies of those assessments, and we definitely review those assessments, and sometimes we use them to determine eligibility. But families are not required to go outside to have an assessment. We perform hundreds of diagnostic evaluations every month to help assist with eligibility determination at no cost to the applicants. So some approximate numbers in 2021, we've assessed about 2,200, we've performed about 2,200 psychological evaluations this year, or scheduled those evaluations. So we have a very robust testing network, and it's a very high volume testing that rivals probably any center in the state to be performing that many assessments. Again, at no cost to the applicants. And not everybody who applies meets eligibility criteria for developmental disability. I think it's important for the community to understand that there are a lot of individuals in our community that need assistance, whether because of mental health conditions or other physical conditions, physical disabilities, or disabilities that come on when somebody is older in life, like dementia, maybe an accident or an illness, a cancer, all kinds of things. So there's many, many people in the community that have disabilities or other types of concerns that need assistance. And regional centers are legally mandated to serving those with developmental disabilities. So it's important to understand that not everybody who needs assistance qualifies for our programs, because our programs are limited for people with developmental disabilities. But we're very committed to, one, identifying as many individuals as we can in our community with developmental disabilities and making them eligible for our services in as timely and efficient process as possible. And in addition, we are also committed to letting families know about other available resources in the community, whether they're eligible or not. Because many people that have developmental disabilities also need help or also need assistance in understanding the school, how to access school-based services, how to access mental health services or other rehabilitative services. And people without developmental disabilities might need that similar assistance as well. So throughout our intake process, we try to emphasize the availability of certain community resources that can be available as well. So I put a little screenshot here of on our website, this little apply for services. That's the button that you can press, and that leads you to an online application that has been overhauled in the last year, and we're trying to make it as fast and friendly as possible to for applications through our website or a mobile device. And if people cannot access our mobile devices, you can also complete a paper application that we can mail to a family, or people sometimes come into our offices and we can assist people complete the application, or they sometimes drop off the application or other materials to the offices. And so I think I've come to the end of the presentation. It went a little longer than I thought it was going to be, but there's just so much material to talk about. And so I'm going to turn it over. I think Dr. Weller, I think you're moderating any questions that have come through, and I'm happy to use the remaining time to answer questions the best I can.
Thank you so much, Dr. D. Very much appreciated and very informative. So we're going to move over. Can everybody hear me okay? Not okay, great. I just wanted to check. We're going to move over to Q&A, and then also know that you can raise your hand as well. So if you would like to participate that way. So we'll be looking out for both. And I see the first question here let me see here. It's about dual diagnosis. And the question is, if someone is diagnosed with a developmental disability and a medical or psychological condition, do regional centers only treat problems related to the developmental disability and other problems like medical issues that are referred to insurance or for psychological sent somewhere else? Last question within that says, what services can the regional center provide and what services are out of the regional center's jurisdiction? I can help with that one. So, Joe, our value is to provide all the services and supports that we're able to do as a regional center, mostly in the form of family support services or habilitative. And of course, we have residential services as well. And when it comes to psychological or mental health treatment, we work very closely with our partners, our entities such as the Department of Mental Health, making sure individuals are connected and accessing those services, or for individuals that have insurance like Kaiser or Medi-Cal, making sure individuals are accessing those services through those entities or working closely with the school district. So in regards to dual diagnosis, our goal there is to make sure that we offer the supports we can do as a regional center and also make sure those entities are providing those services that have a responsibility, a legal responsibility to be providing services like mental health treatment or services offered through the school district. Anything else anybody wants to add?
No, I think, Dr. Wella, you answered very well. I think the point is that we have a statutory obligation to utilize generic resources. So when somebody has, if they have a medical problem, they would then need to use their medical insurance. We're not to duplicate, just like if somebody's in school, a school-age child, their educational services need to be provided through the school. We don't duplicate the services that are available through medical providers or schools, et cetera.
I would like to add to that for our community here that's listening today, really important that if there's any issues or barriers with accessing those services, having any types of barriers with the Department of Mental Health or the school district, to please let the service coordinator know so that way we can help with the advocacy. That way we can help connect those bridges. So if there's a barrier with communication or if there's a barrier with getting a certain service, we need to know about that. And that results in program planning to help make sure that those services can get accessed. And if they can't, we need to know about that as well so we can help problem solve. So I just wanted to add that into the conversation as well when I hear that type of question.
And Jesse, if there's one other to add, and that
Sure.
is there are times when an individual is eligible for a service, and we call it through a generic resource. So that's any entity that has a legal responsibility to serve an individual and they're eligible for that service. And so sometimes there's a gap. So there may be an individual who needs a service, they're eligible to receive it from a generic agency. And the example I'm going to use is in-home supportive services. However, they've not yet gone through the application process. So we are able to fund a similar service, such as personal assistance, while someone goes through the application process and secures a service through the generic agency. And then once that service is approved and they're authorized, then the regional center would stop the funding of the personal assistance and then let the generic resource take over.
Thank you so much. Okay, our next question here. What has the regional center done in regards to communicating to families that were exited at 3 years but are now still eligible under the new criteria for children up to 5 years of age? Great question. So first, I would like to start with provisional eligibility. And North LA, as of last week, is the second highest regional center in the entire state with the most amount of individuals in provisional eligibility. So thank you, Dr. D, and to your team for making that happen. This is fantastic. And for the communication, we did a good communication strategy. We actually communicated to our community in September 2021 about provisional eligibility, making sure families are aware through our news you can use and through our typical communication strategies. And we also put language in there for the specific purpose to let families know that if they need to reapply for services, to contact our regional center and to get connected to go through that process to make sure that they get all the information So we have taken steps to make sure that everybody knows about provisional eligibility and navigating and making sure that people know about this, because it is new to us, but it is working, and it's a really, really good program. So we're glad to get those communications out there in English and in Spanish as well. Anything else to add to that, team?
No.
All right.
Thank you.
Next question, I'm going down the list, and I don't know if any hands are raised yet. Next question, how is the 60-day evaluation timeline triggered? How do families request this time frame? Is the amount of 60-day evaluations completed listed anywhere on the regional center website? So this question is going back to the statutory framework around the 120-day timelines. And this question is specific to that provision that allows for a 60-day expedited time frame when there is a risk to health and safety. And Dr. D'Antonio gave the example, one example around the example with the forensic or individuals who are involved in the judicial system. So the question is coming back here is, how is this triggered, and how do families request this timeline?
Well, I guess, oh, go ahead.
I was going to say, do you want to take it and then I can chime in?
Sure. I mean, basically, I think it's important for you to understand that every single case as it comes through is reviewed by a licensed clinical psychologist, and reviewing that case develop an understanding of the unique aspects of the case. Every case is very individual and unique. If we're looking for, we might discover situations where there's a particular concern about a particular situation. In general, we try to move cases through as quickly as we can for every case. And if there's a case that is recognized as particularly, if there's very obvious that an individual has developmentally disabled, we always try to move those cases through as quickly as possible. So it's really a clinical judgment in terms of our clinical psychologists reviewing the cases they come through and making those types of triage decisions as those cases come through.
And then I wanted to share also, Carlo, and you, I think you could contribute here as well, is when the social assessment is conducted, that is another form of information that's reviewed by, by the team, by the licensed staff. And that would be another area where there would be information regarding, whether one of those three conditions exist in terms of that 60-day timeline. And so my understanding is that our team and licensed staff would look there as well. And if they, of course, see information that's reported that would trigger that 60-day timeline, that is another means of I would say, invoking that timeline.
Mm-hmm.
Am I accurate, Carlo?
Yes.
Okay, yeah. So, was there more to that question, I think?
I would say the question was, how is it triggered?
Okay.
How do families request that time frame? And then specifically, is this on our website? I don't know if this is on our website. I would have to check to see if that provision is on there. I don't think that is there.
Did it state it was wanting to know how? I think the question was, is there an amount of 60-day evaluations completed listed anywhere on our website? I do not believe that we have that information posted. It's not part of the standard information that regional centers do post for transparency. And I don't know that we actually as a center track the number of cases that we evaluate within a 60-day timeline. Carlo, do you know if we track or have?
No, this state of California only tracks the 120 days. That's all.
Okay. All right. Yeah, I'm not sure if we have a capability for doing that technology wise.
No, I'm not aware of.
Okay.
We'll jot it down for feedback though, for sure.
Yeah, it's good feedback.
Okay. See the next question here. What is the process for families to request a site evaluation for a consumer in the Early Start program. An example of a child who was exited out at 3 years old, and there was a request for a school site evaluation, and then that let the individual become eligible for services. And the comment here is that we requested the evaluation based on teacher recommendation, but families may not know that this is an option. Dr. D, are you familiar with that process?
Well, I'm not, you know, I'm thinking the question is asking about the different types of evaluations, and part of the diagnostic process, especially for autism spectrum disorder, does include evaluations in multiple sites. So sometimes you can do an in-office assessment using some of the developmental tools that were discussed in the presentation. And also sometimes it's very helpful to look at that child in another setting, because often behaviors and those social interactions can look different in different settings, from a one-on-one setting with a psychologist to how that child is involving in peer activities. So oftentimes, as part of the standard protocol, it's not just with regional center, but in the diagnostic community, you can do a in-office type evaluation, as well as an evaluation in another site like a school observation, and it can get some very, very helpful information and really help make the diagnosis. And it's something that we used to do fairly, you know, commonly in those selected cases where that was indicated. Because of COVID, it's been very much more challenging to do that. The schools basically, you know, were locked down and nobody could go in. And certainly they're a lot more picky about wanting people to come to the schools. But sometimes we've also done evaluations in parks, you know, in other non-school settings to see that child's peer interactions. I don't know, Dr. Fisher, is there anything you wanted to add to that regarding school observations? I know you've done many of them. If there's something you want to add on that.
Not particularly, but it can be helpful. I think because of COVID, it's extremely, extremely difficult to do it at this time. Some private preschools are allowing us to do school observations, but the public schools really are not prepared to have outsiders in to see their students.
Right. And I just want to emphasize too that, you know, sometimes the diagnostic picture, especially with autism in some cases, can be very challenging, and it sometimes may need a series of assessments. It's sometimes not possible to get the full picture in a single assessment. And that's sometimes when we use those other types of assessments like observations in a school or other setting.
Thank you, Carlo. I wanted to share, we have a hand raised. So, and I'm not sure if it's been raised for the question prior, but so it's Patricia.
Patricia, you can go ahead and unmute.
Yeah, hi, sorry. I don't know, I'm listening to all this and it just seems like you guys are just going about it like, oh, all you have to do is request it and ask for these things. I have a caseworker that just took on 3 of my sons, and I've been asking for help and they just haven't helped at all. And I've been leaving messages and trying to find her email address, and just, I don't know, you guys are just going through it so fast and so quickly, like, oh, well, we do this and we do that. But to me, I just been denied. So it just makes it a little hard to hear you guys just going through it so quickly, like, oh, all you have to do is request this and request for this. Like you said something about requesting personal assistance. Meanwhile, you get the other program going, but you can't get the other program going until you do the medical stuff. And so it's just like a back and forth that you guys are just going back and forth, putting on each other, but nobody's really there to help either program. So I don't know, it just seems like you guys are just going back and forth, just really nonchalant when people are actually struggling and trying to get help for their sons and their kids, and it's just hard. So I'm sorry, I just get worked up.
No, no sorries. Thank you for sharing the information, and I can hear it sounds like it's been very challenging. We would certainly like to circle back to you, and so that we could follow up on
Okay.
the particular issues you've had. So why don't we, you know what, here's what we'll do. Dr. Weller, could we put your email in the chat? And then if you would take that down and
Yeah.
email Dr. Weller, and that way we can protect your privacy.
Oh, okay.
And still be able to get information so that we can follow up. That'd be
Okay, thank you so much. I appreciate that. Thank you.
Absolutely. And while there's some more questions, okay, so I'm going to help out here with questions. Okay, so we have a question. What % of the 2,200 psychological evaluations done yearly are deemed not eligible for regional center services? Dr. Fisher or Dr. D'Antonio, do you have a percentage?
No, I mean, we don't have that percentage. I mean, it's actually kind of hard to track those types of numbers, because the number I cited with the 2,200 is the number of evaluations we scheduled. Sometimes we schedule more than one for one person or this or that. So I don't have the exact number of how many are not eligible, but I did provide numbers about how many people are made eligible for Landerman services. I think that in general, I don't have exact numbers, but in general, this is very rough estimates, but I would probably estimate that about over 90% of early start, people who apply for early start services are determined eligible for early start program. So the great majority, 90+% of our people who apply for our early start program are found to be eligible for early start program. For the Landerman program, it's probably closer to around 60%. It's a lower, because the eligibility is a lot more narrow in terms of what the percentage is. But those are very, very rough numbers. It's actually kind of, we don't have, the data systems that regional centers have. It's kind of, it's somewhat challenging to generate those types of statistics, but we've tried to look at it, and it's probably in the 60 to 65% range. So that just gives an example of that.
And one thing I also could share, and we do, I think you're right, Dr. D'Antonio, there were some numbers there in terms of the number of requests for regional center eligibility versus the number that are eligible. Although I don't know if is that a total number of early start and Landerman?
Yeah, it's a little difficult. I mean, those numbers are a little difficult to compare, because it's a combination of both early start requests and Landerman requests when I put those numbers. It's more just to give a sense of the volume that we see.
Right.
And then not and the assessments are different. So not everybody is determined. There's people who are determined eligible that aren't necessarily receive a psychological assessment because they could have had an assessment from an outside, they could have had an assessment from another state that they showed to us, or they could have had an assessment from Children's Hospital that they brought to us. So we didn't do our own assessment, but we still determined eligible. So we try not, as I think it's important to understand, I mean, we try not to duplicate things. I mean, if somebody's had a terrific assessment at UCLA, we're not going to reinvent the wheel when there's some real high quality assessment that somebody's bringing to us. So just to let you know that we don't necessarily make families get reassessed if the assessment they have is very appropriate.
Right.
And like I said, not everybody receives a psychological assessment to be determined eligible. There's individuals that are determined eligible on some of those medical conditions like the cerebral palsy or epilepsy. There's also people that are determined that sometimes the functioning level is such that they cannot actually be tested psychologically. They're actually so low functioning, so impaired in their abilities that they can't even participate in testing. And we're able to determine eligibility based on alternate measures, like some of the developmental assessments in the early start program, et cetera. So there's not really, to kind of answer the question, there's not really correspondence between the number of psych evaluations we do and eligibility, because there's different ways that people can be determined eligible.
Thank you, Dr. D'Antonio. And the other thing I wanted to share is our eligibility is more narrow in terms of other forms of individuals with special needs. So if we look at regional center eligibility, we have a much more narrow authority to serve because we have 4 clinical diagnoses that are included in developmental disability, and then the 5th category, which is a statutory definition, versus in comparison to school districts, say, for example, which have a much larger eligibility for services. So because we have exclusions in terms of physical disabilities and learning disorders and solely psychiatric, there are far greater numbers of individuals who may be impacted with a disability and far greater than the individuals that we're able to serve. And so I think that that also contributes to the numbers in terms of individuals who are referred to regional centers and may be very substantially disabled by a different disability. Learning disabilities can be very substantially disabling, as can psychiatric disorders. And yet, unless that developmental disability is co-occurring, that's someone that we would not be able to serve. Yet, we may conduct a psychological evaluation to help us determine whether or not a developmental disability exists. So I think it's important to know that piece as well. Helps provide some context. Okay. Next up, how do families know Regional Center assists with program planning? Is it posted on the website or literature? Could we have, is that a little more clarification might be helpful. Letty, are you referring to the individual program planning process or different program planning? Ah, there, she's joining.
Yes, hello. In regards to, you said that Regional Center assists in program planning if they are denied services from other providers. You mentioned IHSS, schools, etc. How do parents know, or how do families know that that's available?
In terms of the service being available?
That the Regional Center can help with that.
It's part of the program planning process. So it's, and in terms of how do we inform families about the program planning process, we've got information that's available to families. So when a family goes through the orientation, there's information about the program planning process, what to expect for individual program planning, which includes the program planning around generic resources. So when a regional center develops an individualized program plan and establishes the outcomes through assessment, the program plan, or the plan to assist someone in achieving that outcome may include both regional center funded services and or services that are available through a generic resource. So that program plan really should capture all the various services that an individual needs to achieve the outcomes identified in their IPP. And so it's part of the planning process. Typically, our service coordinators, when they first meet with a family who's new to the center, will explain the program planning process. And then also the family will get the printed information. And we likely, I would think, have resources on our website as well for families to receive or to access. And more recently, we've implemented our local grassroots outreach, where we're providing information to various locations in the community regarding regional center services and the individual program planning process.
Great, thank you.
Ruth, I can do the next one.
Sure.
If you would like. The question is, what's the standard operating practice for caseworkers to return emails or phone calls? And in this situation, the caseworker took 3 weeks to respond, and only after escalating to a supervisor. So please know that our business practice is to return the call within 24 hours. So if there's an emergency or something that needs urgent attention, or please reach us. We also have our on-duty unit team that's available as well. And then the service coordinators are expected by the next business day. So whenever you're not getting a response back, either by email or phone, please let our supervisor of that team know, or the on-duty team. That way we can take a look at, because that means that the practice isn't working. So we want to know about those situations so we can help address. But no, that's the expectation across our organization, are for return calls same day if it's an emergency, or no later than 24 hours out in the field. And we really try, and a lot of our service coordinators start their day with checking their voicemails that came in from the day prior, or their emails, helping establish their schedule for that day. And then also by the end of the day, really depends on where they're located and what appointments they're at, and where in the catchment area they're driving to, being out in the community. So, but please let us know, and if there's any issues that come up around communication to our center, very important that we get timely responses back to everybody.
Okay. And I think that covers all of the questions that we've had in the chat, or in the, I'm sorry, the question and answer feature. Are there any questions that someone would like to ask verbally? Not seeing anything. Well, if there are no other questions, give it just a moment. We have a little bit of time. So let me point out that resources, there's a link that has been posted in the chat that is a direct link to our publications. And that, I believe, was in response to the question regarding where information can be accessed regarding the program planning process. So please take a look in your chat, and you can check out that link. And oh, I think, all right. And so I don't think we have any other questions. So I guess we'll wrap it up. I want to thank everyone for participating this afternoon. And thank you to our presenters, Dr. D'Antonio and Dr. Fisher and Dr. Weller. Thank you so much for putting materials together today, and Dr. D'Antonio for your presentation. Thank you to our interpreters for your support, and of course to our fantastic North LA staff, to Ms. Sylvia Bonilla and Ana Maria Parthenis Rivas for your support on this call, and also Jennifer Williamson in public information. Thank you so much. And with that, do know that this is recorded. It will be available on our YouTube channel. We'll have a link on our website that will take you directly to this recording. So if you want to go back and refer to information, or if you'd like to share with others that this information is available, it will be posted in the near future. And with that, I thank you once again. And I hope everyone has a happy holiday season and a very happy new year. Take good care, everyone. Bye.